namely that antidepressants often do not do what they promise and are in fact causing harm to many.
Dr. Steve Hotze is suing over Obamacare's employer mandate.
It's time for a wellness revolution. Brought to you by Hotze Health and Wellness Center. Honest discussion on maintaining health and wellness naturally to enjoy a better quality of life.
He's the doctor fighting to let you keep your doctor.
Now, Dr. Stephen Hotze.
Welcome to Dr. Hotze's Wellness Revolution. This is Stacey Banfield here with Dr. Stephen Hotze, founder of the Hotze Health and Wellness Center. And just a reminder to download.
I just found it. I just walked around and just there it was, the Hotze Health and
That's right,
Wellness
and that
Center.
makes you a founder.
I'm the founder.
Congratulations. And also founder of the podcast. So all you have to do is go to hotzepodcast.com. That's HOTZE podcast.com to download all of our podcast programs. So there is something seriously lurking in your water you may have heard about. However, you may not know how much it can affect you negatively, your health. So very important topic today. We are talking about fluoride. Fluoride in the water.
Right. You know, in America today, 70% of the population is overweight. Those of you listening in the audience or watching here on YouTube, by the way, if you're watching on YouTube, you can subscribe right away, so be sure to do that. For those of you listening or watching, I know that 70% of you have a weight problem, and half of you that have a weight problem are obese. That's the statistics in America. 70% overweight, 35% obese. That's a lot of people carrying around a lot of excess weight. In the early 1960s, the statistics were a lot different. 16% of the people were overweight, and 8% of the population was obese. What's happened over the last 50, nearly 60 years to cause this huge weight gain in our population? And I would tell you that the problem is, in my opinion, and I think I've done enough studying and reading that I've come to the conclusion that it's fluoride in the water that has led to weight gain. You know, how in the world would fluoride make you gain weight? Fluoride can't make you gain weight because fluoride adversely affects your body's ability to properly manufacture or produce thyroid hormone in the thyroid gland, and it also adversely affects your body's ability or your cell's ability to convert the inactive thyroid hormone, which is the predominant thyroid hormone made by the thyroid gland, which is T4. My hand's the thyroid molecule. My 4 fingers sticking up would be the 4 iodine atoms. Thyroid has iodine. You've got to have iodine to make thyroid hormones. And the inactive thyroid hormone has 4 iodine atoms. It enters the cells of your body, of which you have about 40 trillion, and there an enzyme called deiodinase, which means to take off an iodine, an enzyme that strips an iodine off the thyroid, does just that. It converts T4, the thyroid with 4 iodine atoms, to T3. That's the active thyroid hormone that has 3 iodine atoms, and that active thyroid hormone then activates your power plants within your cells, which are called the mitochondria. It enables the cells to produce electrical energy, which is then transported through a mechanism called ATP, adenosine triphosphate, carries these electrons to the biochemical processes that need the energy so your cells can function well and your organs can function well so you're healthy. So thyroid hormone enables your mitochondria or your power plants to produce higher levels of energy. So you got 2 ways you can live your life. You can either live it with low energy, which means you're going to have a low metabolism, which means you're going to gain weight, or you're going to have high energy production, and you're not going to have all the health problems that people experience. You're going to have good metabolism. You're going to think clearly. You're going to look sharp. You're going to be a good ideal body weight. You're going to have get up and go. You're going to have vim and vigor. Your heart's going to work well. You're not going to have diabetes. Your joints are going to work well. You're going to feel fine when you produce energy within your cells. So fluoride is a problem because it poisons the enzyme that enables you to make active thyroid hormone within your cells. It also inhibits the thyroid gland from properly producing thyroid hormones because it competes fluoride, which is the negative ion of fluorine. And if you go back to chemistry, go back to your periodic table with all the different elements. There are 120 or 30 some odd elements. There's a class called halogens. And in the halogens, you have chlorine, bromine, iodine, fluorine, and several others. They're all halogens. And the halogens compete with one another in our body system. So we get fluoride in our water. 70% of the population in the United States drinks fluoridated water. Now, let me give you another comparison, another statistic. Currently, in Europe today, 16% of the people are overweight, 8% are obese. That harkens back to the United States back in the 1960s when 16% were overweight and 8% obese. Why is it in the United States that we have this huge weight gain, but we don't have it in Europe? You can say, well, we eat all this junk food, right? And we're eating McDonald's and we're eating pizza and pasta and, rolls and, Twinkies and all that sort of stuff. We're eating a lot of sugar and we're just eating junk food. That's why we're big and fat. Well, you go over to Europe, let me tell you what, they eat a ton of pasta, I guarantee you, and pizza in Italy. If you've been to France, you don't get a bread basket on your table. They bring a bread cart with loads of bread. They drink wine by the gallons. They use olive oil all over Europe. I mean, these people eat heartily, but they're not big and fat. And guess what the one difference is? In Europe, they ban fluoridated water in the continent. Almost every country, major country, bans fluoride in the water. In the United States, on the other hand, it's put into the water in the United States. Now, why would they do that? Oh,
it's a racket, is what
it's a racket. And what they say is, well, it helps prevent cavities. Oh, if that were true, and it's not. If it were true, okay, so to prevent cavities, we're going to poison our thyroid hormone, which governs our body metabolism, so we can be sick. When you're overweight, those of you that are overweight, you know what problems that's associated with. An increased risk of high blood pressure. Diabetes, which leads to heart disease and strokes, kidney disorders. You get degenerative arthritis. You get a host of health problems when you're increased risk of cancer when you're overweight or obese. And what I'm telling you is that it's the fluoride in the water that is having an adverse effect on your health. Now, you go, but my dentist puts it on my teeth when I go there. My dentist does too. And I said, no, thank you. In fact, I wrote him a note, my dentist, and said, why in the world, with all the scientific information about fluoride toxicity, why in the world would you put it on somebody's teeth, particularly since it affects their thyroid function? So here's what happened. Back in the 1950s, the fertilizer companies used to spray fluoride when making their phosphate fertilizer. The fluoride was a byproduct. It would be spewed out at the mills through the smokestacks. And what they found, and this happened in Florida first, they found within about a 4 or 5 mile radius, the crops didn't grow, the animals got sick, they died. And so the EPA at that time came in and said, you can't be spewing this. You're going to have to scrub the brushes, and you can't spew it into the environment. So now, by the way, fluoride is toxic. It's a toxin. That means it's a poison. Why would you put a poison in your body? So what they did is they had to take the fluoride, and then they would have to dispose of it, which cost a lot of money. Well, it turns out some scientist somewhere went to an area of the country that had fluoride levels that were high and found out, well, the kids have lower incidence of cavities. He sold the idea to the fertilizer companies and said, you know what? Why don't we take this toxin and we'll sell it to the cities and tell them it'll keep the kids from getting cavities? So when I was growing up back in the 60s, there was a huge debate on whether or not there would be fluoride in the water. And 70% of the municipalities in the country decided, yes, we're going to add fluoride to the water. And fluoride, as I told you, is a toxin. It causes a host of health problems. Not only does it poison the enzymes when you make thyroid hormone in your gland, but it also adversely affects your ability to take the inactive thyroid hormone T4 and convert it to the active thyroid hormone T3. It inhibits your pituitary gland from governing the thyroid hormone. It displaces iodine, which you need to produce thyroid hormones. It leads to brittle bones, arthritis, increased risk of bone cancer. It can cause poor development of the baby in the womb. It increases infertility and damages sperm cells in men. It can lead to brain damage. It can lead to problems with the teeth, discoloration and brittle teeth. It can lead to cardiovascular disease, cause dementia, and it's a mutagen. That means it causes genetic damage that can lead to the production of cancer. Now, all you have to do to know what I'm telling you is the truth is look at the material safety data sheet that's put out by the federal government. It's called the MSDS. Go on the Google it and look up fluoride and just see that it is a known toxin. Now, what's really odd, and I asked them to bring me the toothpaste, and I don't think they did, what on the side of your toothpaste, folks, you look at it. You look at your Crest or your Colgate or whatever toothpaste you're using, and there's a warning box on the toothpaste. And the warning box says this: do not let anyone under 6 years of age use this. And secondly, if you swallow what's on your toothbrush, call poison control or get medical help immediately. Now, why in the world, and why is that? Because there's fluoride in it. There's fluoride, and it's a toxin. Why would we put a toxin in toothpaste? You can buy non-fluoridated toothpaste. Here at the Hotze Health and Wellness Center in our vitamin store, we sell Spry, S-P-R-Y, which is not fluoridated, and there's no warning label on the toothpaste. Also, so here's what you need to do. You need to get fluoride out of your life. And the first and foremost place you get it is in your tap water. So what you need to do is get some filter system, whether you buy a filter that you pour your water into, whether you get reverse osmosis underneath the sink. At our home, we filter the water coming into the home to filter out the chlorine as well as the fluoride and other petrochemical toxins in the water. And then we double filter it with reverse osmosis for drinking water. I've done studies on this and sent it off to the lab. Regular tap water versus the tap water in my house that has reverse osmosis, and regular tap water that you are drinking that hasn't been filtered is full of petrochemicals. It's full of chlorine, which is a halogen, which also adversely affects thyroid function, and fluoride, which adversely affects your ability to utilize your thyroid hormones. But when I take it out of the reverse osmosis, it's clean as a whistle. So you've got to drink filtered water. I don't mean water out of a bottle, a plastic bottle, because it's full of all kinds of plasticizers and petrochemicals that are leached out of the plastic. So you're not doing yourself a favor if you're drinking plastic bottle of water. Get yourself a filter system. Cut out your toothpaste. Those are the two biggest places, and you'll find fluoride in some food products and other home products. So you want to eliminate your exposure to that. If you do that, that will be a dramatic help on your thyroid function within your cells and your ability to produce thyroid in the gland. So your takeaway from this is that fluoride in the water is a common cause of low thyroid in individuals. That's why when I look around in the population, I see scads of hypothyroid individuals, and you're one of them. And you've gone to your doctor, and they've done blood tests, and, well, your thyroid's in the normal range. Well, everybody's in the normal range, essentially, because the way the labs define what's normal is they take an average of the last 1,000 people who had their blood tested, and most of them are older folks like me. You don't have a bunch of young kids checking their thyroid. It's all people that are midlife or later. So they take the average, and then they have a statistical term called standard deviations, 2 standard deviations, and they call that wide range, little abnormal. It encompasses 95% of the people. I believe this: if you have the symptoms of hypothyroidism, you deserve a therapeutic trial of thyroid. You don't need, your blood tests don't tell you in and of itself, the TSH doesn't tell you that you have low thyroid within your cells. What tells you that is your symptoms, and your clinical symptoms, of course, are going to be significant loss of energy. In most cases, it can be difficulty with weight. It can also be not only weight, but inability to focus and think clearly. Low body temperature, it should be 98.6. We find it 97.6, 97.2, 96.8, and the low 96s in most of our guests when they come in. Also, poor sleep habits, joint muscle aches and pains, bowel functions not good. If you have significant hypothyroidism, in fact, you can be constipated. That's a classical feature of hypothyroidism. If you've been on a lot of antibiotics, you could have irritable bowel syndrome because you've knocked out the normal fluoride, you got yeast overgrowth, and that's another discussion at another time. Loss of the lateral third of your eyebrows and enlarged tongue. You can stick your tongue out and let it hang in a mirror. If you have mottling across your tongue, that's a sign of low thyroid. Dry skin, brittle fingernails. People with low thyroid don't produce enough energy to have a healthy immune system, so they get recurrent and chronic infections. They get on antibiotics. Women who are in reproductive ages will have problems with fertility. It's a very common problem, infertility in our country, and the most common cause is hypothyroidism, but they're not going to treat you for that at the infertility clinic. They're going to spend $25,000 or $50,000 on artificial insemination and in vitro and all this sort of thing. I tell women, look, if they're having infertility problems, they come in and we balance their hormones with thyroid hormones and the female hormones. I always tell them, don't blame us if you get pregnant. And commonly they do. It's very simple and inexpensive compared to in vitro fertilization. So in miscarriages, another common finding we have with hypothyroidism. So hypothyroidism is a problem that is caused in large part by fluoride in the water and in our toothpaste and in other food products and household products in America. You want to eliminate that as much as possible. And if you have the symptoms of low thyroid, I believe you deserve a therapeutic trial of desiccated natural thyroid hormone. That's what we use here at the Hotze Health and Wellness Center. I've been on it for 25 years myself. And we've used it with tens of thousands of our patients, and they have done remarkable. As a matter of fact, the most common thing they tell us, the outcome once we get their hormones balanced and on a good eating program and on vitamins and minerals, they say, doctor, thank you for giving me back my life. And if you want that, if you want to get your life back,
all you have to do is give us a call at 281-698-8698. That's 281-698-8698. Dr. Hotze, such great information. I'm sure a lot of people didn't realize that maybe the cause of their obesity, cause of infertility, could be the fluoride in the water. You're certainly not going to hear that from any other doctor. And just remember, everybody needs a health coach. Give us a call if you want to do a 180 and take charge of your health. 281-698-8698. That's 281-698-8698. Thank you for joining us today here at Dr. Hotze's Wellness Revolution.
Information provided on this radio program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution radio program advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this radio program is at the listener's discretion.